One of the really, exciting and I think heartening things to see at these conferences the past 3 years, and I'm sure it'll be the case this year, is the dialogue that happens between attendees and people who haven't maybe met each other or worked together before, but have a very common interest and passion in this space. And we try to allow enough time for people to really have some time to have good dialogue and talk about what they're doing at their institution, what challenges they're facing, and how they're meeting those challenges themselves. The last couple of years we've had some healthcare groups who really are new in this space and are building new teams around systems engineering, quality, operations research in healthcare settings, and those kind of new leaders of those groups have come to the conference to really understand how they can build their team, how they get engagement in the practice, how they really work on the most important things. And again, to see what others are doing and really help them get a vision for their team as they start to set those up in some fairly large institutions around the country. So I think that's been one of the neat things to see. Also, it's just those dialogues have spurred lots of sharing back and forth I think on an ongoing basis as people have built their networks. And that always has lots of value just in itself to build those professional networks of people who have similar similar passions, similar areas of focus. So we felt very good about that. There's been a few groups who have actually come together to submit funding requests through the National Institute of Health or the other groups like HRQ or others. So we think obviously this kind of interaction and synergy leads to people having some bigger ideas that are bigger than their individual institution, and really can bring together people to compete for center funding or grant funding that's broader than their institution itself. We do work hard to get attendee feedback on what's worked well and what hasn't worked well at the conferences. So we get evaluation, regularly from our attendees, and by and large, I think we've had very good feedback on the value of the conference. We've tried to work hard to keep costs down and what the conference charges compared to other conferences that are similar around the country. We think that's important. We try to engage students in the process and keep their fees at a lower rate. So we very much want to have kind of the next generation of people coming into this space, hopefully be engaged and more engaged as we move forward, to have students in engineering schools, medical students, others who are just coming into healthcare as a career, be part of this, see the opportunities that they can contribute to, and really feel like they have a space that they can apply their skills. So I think that's been invigorating as well for those who've maybe been in the field a while, to have some young blood come in and some new ideas and some new energy and passion come in has been fun, and especially in a lot of the posters. We've had very good poster response. We usually have anywhere from 30 to 50 posters that or cover a wide range of topics, and many of those are people younger in their career or potentially even students who are working in this space. And again, that brings a whole new level of energy and kind of passion and new thought to the table as we look to the conference.